is Susanna. I'll be your nurse today. I'm washing my hands. I am going to do assessment today. Is that okay with you? Can you tell me your name and date of birth?
Joe Nixon, February 3rd, 1984.
Thank you. And which year is where are you at?
Bergenmer's.
And who is our president?
Trump.
Okay. So I'm just assessing the patient as I'm walking in the room. I'm looking at if he's oriented and he seems dressed properly. He's making eye contacts with me, and he feels that he's understanding my questions, and then he's oriented. So I am going to take his vital signs. Is it okay if I take your vital signs? So I'm going to listen to the patient. I'm going to take a temperature first. 98.5, that's Fahrenheit, that's normal temperature. I'm going to listen to the pulse. And for the sake of the video, instead of listening to the whole minute, I am going to listen to 30 seconds. His pulse is 60, and that's within the normal range. I'm also going to take a patient's blood pressure, and I'm going to ask patient about the pain. Do you have any pain? Any numbness, tingling, headache, vision changes, or anything like that? Okay. So the next area is going to be abdomen assessment. I'm going to have you lay down over here. And I'm going to be inspecting the abdomen. I'm going to be expecting it from this angle over here. I'm going to watch it, and I'm going to over here as well from above the patient's head. Make sure that expansion, and then there's no swelling or anything like that. The next part I'm going to do, I'm going to watch also as I'm doing all of this. I'm going to watch for skin color, surface character, contour, and surface movements. I'm going to watch for the hair on the abdomen, and then this is normal for males to have some hair, and the hair is also even distributed. And I'm going to auscultate the bowel sounds. I'm going to listen to all 4 quadrants. And as I place stethoscope, my patient already has some bowel sounds, but if patient did not have a bowel sounds, we can listen all the way from 4 minutes to 30 minutes to see if patient has any bowel sounds. And then we're going to also auscultate the vascular sounds. There are 7 spots, and there are 3 this way, 3 this way, and 1 in the middle. And hopefully we will not have any, because we don't want any or hernia or anything like that. And then we are going to palpate the abdomen lightly for muscle tone and surface characters. Palpitation is, light palpitation is like a 1 centimeter. And then we watching for swelling, masses, or anything like that. And then we're comparing both sides too. Make sure that the sides are both equal. And then we're going to press abdomen a little more deeply, and that would be for about 4 to 6 centimeters in depth. And then we're also comparing both sides too. Any pain when I do this? Any of these palpitations that I did?
No.
Okay. We're also going to do percussion of the abdomen for tones. There's like a 13 spots. So you kind of go from this direction, and they go all the way around like that. And then we're going to percuss kidney for cotocerebral angle tenderness. And then we'll ask the patient to sit at the edge of the bed over here. And we are going to take a fist and basically percuss like that. The next part that I'll have a patient do is, I watched the patient already how patient sits and all the eye coordination and everything, but I'm going to have a patient stand, make sure he's stable, his hands are down, and then I'm going to have walk patient back and forth across the room. I'm going to watch for his balance. Have him go on a tiptoe, come back this way, and then have patient stand right there, close your eyes, and make sure that he's balanced that way as well. And the next thing I'm going to have patient do is have a seat right there on a couch. Put your hands on your knees, and then go flip back and forth, your hands quick. Okay, he's doing okay with that. And then the next thing I'm going to do is have patient lay down on a couch, and I'm going to check his legs. I'm going to have him flex his knees towards the back and then straighten out, and then I want to do that with both sides. Okay. Okay. The next thing I'm going to, during this whole assessment, I'm watching for patients' facial symmetry, make sure that there's no drooping or anything like that, such as in stroke or Bell's palsy or anything like that. Also, when patient responds and talks and everything, make sure that that's proper as well. And the next thing I'm going to do, I'm going to watch for sensation in patient's foot. I'm going to ask patient, does he feel dull, sharp? How do you feel?
Sharp.
Okay. And check his other foot as well. And the next thing I'm going to do, I'm going to have patient close his eyes. And close his eyes. And I'm going to ask him to recognize this object.
Pen.
Okay. And you can open your eyes. And then next thing I'm going to ask the patient to, what is this letter that I just wrote on your back?
F.
Okay. I'm going to check for reflexes. Obviously, I'm going to, for the sake of the video, I'm going to do this little compromise that way. Patient's leg can kind of dangle, but I would check both, obviously. I'm going to check for patella right over here. And I don't have the hammer that we use to check, but I'm going to use my stethoscope. Okay, patient has a good reflex right there. The next part I'm going to be assessing is the cranial nerves. During this whole assessment, I was assessing the patient's face and everything. We are going to observe his face, and we're going to have him raise your eyebrows, puff your cheeks, smile, show your teeth, purse your lips, and blow. Seven cranial nerve is for the eyebrow, and we're watching, make sure that both sides are equal. And then the next thing is we're going to palpate his temporomandibular side over here. I'm going to have you clutch your teeth, and then keep moving over there. Make sure that those are all equal, and there's no cracking or anything like that, and then there's no pain. Is there any pain in any of those?
No, ma'am.
Okay. The next thing we are going to watch for cranial nerve 5 to test the face, and I'll have you close your eyes. And you feel that? Okay, that's cranial nerve 5. And then And the next is orthophonal gag reflex, which is cranial nerve 9 and 10. And if I had a tongue thing, I would have you open your mouth. I would get the tongue compressor and watch for your gag reflex and pushing that tongue compressor a little further down. But I would watch for reflex and movement of the soft palate. And inspect the tongue in symmetry, strength and abscess of tumors. Test muscle strength or cranial nerve of 7, which is hypoglossal. So we're going to watch it over here. Okay. And then we are going to check for the neck and the muscle strength. We're going to, does this hurt or anything like that? No. Okay. And I'll have you turn around in the back and watch the back of the neck over here. We're going to do percussion right there. And then we're going to do that. Any pain or making sure that's all even and symmetrical. And then make sure that that's all aligned with the spine over here. Next part, we're going to check patient's shoulders. I'm going to squeeze over here and make sure that's all symmetrical. If there's any masses or anything like that, any tenderness?
No.
Okay, I'll have you shrug your shoulders up, down, okay? And I'm going to check your range of motions. I'm going to have you lift your hand up and back, and then up and behind down. Okay, any tenderness or anything like that? And obviously we would do that with both sides, up, down, or anything like that. And I'll have patient push this up and make sure the strength is okay. Okay, that's good. The next part I'll have you do is check your hands. I'm going to have you check your wrists. I'm going to palpate all the joints, make sure they're okay and there's no pain or anything like that. Okay. The next thing I'm going to, and obviously I'm going to do with both hands, make sure that's all symmetrical as well. The next thing I'm going to have you do is bend your wrist and extend, and do that with this side. Okay, and then we'll have you check each finger with your thumb like this. Okay, I'll have you push down, make sure that your strength is okay, push that out. Okay, and then I'm going to check your wrist over here, make sure that that's not tender, that that's okay. And we're going to have you do flexion and extension, okay, with both hands. Okay, and then...
You said wrist, that's my elbow.
I'm sorry, elbow. And then we're going to check for strength. I'm going to push over here. I'm going to push, you push on here, and then the other way around too. Push, okay? We're going to check for patient's carpal tunnel test as well. We are going to have patient do this. Yep. And then keep holding that like that for 1 minute. And then if patient feels any numbness or anything like that in a carpal part over here, that sounds like a positive test. And then also we are going to, another way you can do that is you percuss this part over here. And then there's any numbness or anything like that in that area. That might be a problem with carpal tunnel or anything like that. The next part, we are going to check for patients' legs and hips. I'm going to have you extend your leg up and bring it to yourself, your knee. Okay, and we're obviously going to do that on both sides. And then I'm going to have you bring that knee back this way. We're checking for your hips and clicks and all that and extension. And then I'm going to have you go back on your stomach and then bring your leg up. Lift your leg, the whole leg up, the whole leg up, and this leg as well. Any pain or numbness or crepitors or anything like that?
No.
I'll have you have a seat. The next part, I'm gonna have you stand actually. I'm gonna check for your hips. I'm gonna touch those joints, make sure there's no pain or anything like that. And that's all good. Okay, we're gonna check for extension and flexion of the legs. Any problems with that? Any pain or anything like that?
No.
Okay, and then I'll have you have a seat. I'm gonna have you lift this leg up again. Extend and flex, do all that. And as we are doing all this, we're assessing for edema, color, bruising, tenderness, and stability. And then we're asking patient to do range of motion with both legs. We're accessing each toe for any, in all these little areas over here. Push up and then down. Okay. Any pain with any of that?
No.
Okay. In this area, we're going to inspect patient's anterior wall of chest wall, and we're watching the color, symmetry. We're looking on the side, make sure the patient doesn't have barrel chest or anything like that. Watching for color. And also we're watching for pulsation, lifts, whoos, and highs, and then we're going to auscultate. We're going to start over here, and then move over here, right over here, and mitral valve sound over here. Normal auscultation for the patient is 60 to 120 minutes. This patient had normal heart rate, and we're watching also for S1 and S2 heart sounds. We're watching for a rhythm, abnormality, and make sure there's no any pitch or a splitting or anything like that. Palpate the anterior chest of the wall and make sure there's no masses or anything like that. We're going to percuss the border of the heart wall. And then watching borders for the size, perform peripheral vascular system. Pulsation is visible, but not the veins of itself, of the jugular veins or anything like that. We can see it, but then we can see the veins. We are going to place our hands over here, and then we're watching for carotid pulse amplitude and perfusion on about a third of the neck over here. Okay, and then we're going to escalate coronary artery for bursitis. Make sure that patient doesn't have anything like that. And then we are going to palpate pulses for rhythm, amplitude, and contour. And we're also going to check brachial pulses as well. Make sure they're all equal and same. Make sure there's no problem with them. And then we're going to also check the radial pulses. Make sure they're equal. And we're all of those we're listening for 1 minute. Make sure that also that we have a good perfusion. Is there any pain with any of those for some reason?
No.
Then we are going to Palpate the upper extremities for skin turgor. Watching for turgor and color and integrity and temperature, and capillary reflexes as well. We're watching for hands, capillary reflexes for that, and then we're also going to inspect and palpate the lower extremities as well. Make sure the color is okay. Make sure there's no bruising, no darkness in the lower part of the extremities, and no edema. And also for capillary reflexes, capillary refill on the toes, on the nail parts of the toes. We're watching for any temperature changes. We're watching for hair distribution, and we're watching for superficial veins as well. And we're watching also for the femoral arteries right over here. We're checking for those, and palpate the pulses of amplitude of femoral and pulpatilla. Pulpatilla is in the back of the knees right over here. So we're watching for those. So these are femoral over here, and these are pulpatilla pulses. When we are assessing a patient's respiration, we're watching for quality, we're watching for posture. Posture is important because patients that are compromised with breathing, they have a benched, clenched kind of a posture. And we're also watching for effort, and we're asking about pain. Do you have any pain breathing or anything like that? Okay. And then we're watching as well, and again, we're watching for the skin color, we're watching for the lip color, and we're watching for the nails, and we're watching for the respiration rate. The normal respiration rate is 12 to 20. And then this patient has a rate about 16, which is normal. We're watching for the shape, and every time we're listening to the heart sound, we're watching the symmetry from one side of the lobe to the other. The right side of lobe has 3 lobes, and then left side has 2 lobes because the heart is located there. And we're watching for the diameter and difference in using the muscles and coastal angle. And then we're going to listen to the breath sounds. We're going to start over here on top of the lungs, apex, over here, nice big breath sound. Nice big breath sound. Right here. Make sure that we don't have any crackles, wheezes, friction stridor, or any wheezing. And then we're going down. We don't want to do it in this area because this is where the areas of the lungs are. Nice big. And we're going down. Because this is where our scapulars are, so that's why we don't listen to that area. And then we're listening to the this part over here. Breath sound. And then we compare it to the other side. And then in the back, we're doing the same. We'll find that area right there. Big breath. Compare it to both sides. Big breath. And of course, big breath. Okay. We're palpating for thoracic expansion of the back of the chest wall. Big breath. Make sure that the skin spreads out when we do that. Palpate the front as well. Okay. Watching, we're doing percussion of the chest wall and listening for the sounds. As well. And $99.99. We go all the way around and we do percussion. Okay. In this segment, we're going to assess patients' skin, hair, and nails. We should ask patient, does he feel any dryness anywhere? Are you taking medication?
No.
We're going to ask, do you have any bruising, redness, any moles, any lesions? And moisture or any temperature changes. Okay. When watching the skin color, we're watching for paler or pale, and we're watching erythema or any redness, and we're watching cyanosis or kind of like a bluish coloring. And we're watching for jaundice in the skin area or in the sclera of the eyes, and we're watching for erythema. We are watching the hands, the hands color of the patient's hands. We're watching for nail beds. We're watching for clubbing of the fingers. We watch that from straight, and we also kind of watch it for a side. Make sure that the diameter is not raised or anything like that. And then we're also watching for any moisture. Make sure it's not overly dry, and make sure that skin is smooth. We're watching for any wounds or lesions. And then we're watching for turgor, pinch, and mobility. And we're watching for the healing of the wounds as well. We're watching for any veins. We're watching, just like we check the hands, we also watch the feet of the patient for the color, obviously. And also for the nails. The nail part, we watch thickening of the nail. Sometimes the thickening of the nail happens with age, or sometimes with the fungal infection. Patients do have a little bit thickening of the nails over there, of the toes. And we're watching for texture, mobility, and thickness. And make sure that they have a nail bed. Sometimes that's important to note too. We're also going to inspect the hair. We put the gloves on and make sure that patient doesn't have any lice or anything like that. We check all sides. Make sure that the patient doesn't have any alopecia, which is thinning. This patient has all his hair. There is a little bit of change in the color due to age. It's getting silver. And then we also palpate the head, make sure there's no swelling or any lesions or anything like that. And then when we do watch, just to go back to hands, clubbing less than 60 degrees, they need to be round and firm, but not like overly clubbed down. We palpate the nails for the shape, contour, consistency, color, thickness, cleanliness. Make sure the patient is cleanliness, any smell to the patient, and capillary refill as well. Less than 3 seconds. If there's any clubbing or anything like that, it's due to respiratory issues. When we watch inpatient skin, we watch the stomach and the back. Make sure patient doesn't have any raised birthmarks or anything like that, and they are not changing in size, color, shape, and diameter. As long as they're less than 6 millimeters, and then the patients cannot reach the back of their head, suggest that the family members watches out for those for them. I would just want to thank the patient and have a great day. Thank you for letting me assess you.
Thank you.